pleased to be able to give you the July podcast from our beautiful, newly refurbished maternity unit. The first thing I'd like to talk about is our challenge of accident and emergency, and I'm delighted to be able to say that we met our May target, seeing 95%, over 95% in fact, of patients within the 4-hour standard. Now, that doesn't mean to say we're complacent. We still have days where it's not as good, and whilst we are making huge improvements, we've still got some way to go. It means not just the accident and emergency department, but the whole hospital having to work differently, ensuring that patients who do unfortunately need admission get that done as efficiently and effectively as possible, have the care they need, and then a good discharge. One of the things that we hope will be very much helping both the accident and emergency standard, but the whole care we give patients, is that we're going paperless. First of all, in the accident and emergency department, something that very few departments in the country have actually had the bravery and technology to do. And it's thanks to our staff in the accident and emergency department and our own IM&T team who have developed a system that allows us to do this, using iPad type of technology. It's still early days and we've had a couple of glitches where in fact the main computer system didn't work. It was allowing us, however, to test the system, and yet we had the full contingency of going back to a paper system to ensure that no patient didn't receive the right and proper care. The good news is it really means that when patients then do go into the hospital, there is a full electronic record of the care they received in accident and emergency. In terms of the transforming unscheduled care, of which the accident and emergency standard is just a part, what we've also done very recently is set up a brand new clinical decision unit which will allow patients such as head injury patients and those who only need a short term of observation to stay in the hospital without being admitted. We've also got a brand new ambulatory care unit that is managed by acute physician consultants to allow patients who are both referred through by their general practitioner but also who come through the accident and emergency department but only need to be treated on an ambulatory basis, short stay, to do so. And finally, we've made significant changes to many of our doctors' rotas. That allows us to ensure that we have the right number of doctors in the right place to be able to treat patients when they need that care. We've continued to run the National Friends and Family Test. It's going very well in terms of the numbers of people who are saying they're extremely likely or likely to recommend our services to their friends and family. Where we're not doing as well is actually the pick-up rate. It's something that's really important to us. We need to hear people's views, and so we're encouraging our staff to encourage patients, but also using volunteers in the accident and emergency department to help patients to complete their documentation. In terms of the board, we're looking to continue to strengthen the board, and the 2 new non-executive posts, one being a vacancy and one being a brand new post because of the wider configuration of the hospital and community services that we now serve. The recruitment process has been undertaken recently, and recommendations on 2 new posts are going to the Council of Governors meeting on the 3rd of July. Soon after that, I'm looking forward to being able to meet our 2 new non-executive colleagues. We've also been looking to strengthen the executive team, and I'm in the process of recruiting to a Director of Workforce and Organisational Development with interviews mid-July, but also I'm very pleased to be able to announce the appointment of our brand new Chief Operating Officer. This was a competitive recruitment process, and James Sumner, who has been our Acting Director of Operations and then Acting Chief Operating Officer, has been successful in this post. I very much congratulate James, and I know many people will look forward to working with him over the coming months and years. Talking about the board, we're actually getting our non-executive directors and chairman to roll their sleeves up and get involved in direct patient care and support. We've got them all going on to wards and actually working with healthcare assistants and other professionals. One of them actually undertook this work the other day. He did 3 hours, was absolutely exhausted at the end, but thought it was a fabulous experience and he learnt so much. He's now champing at the bit and wanting to do his next session. In terms of diary dates, I'd very much ask those of you who have not yet put it in the diary to mark the 17th of July. It's a significant day when we have the National Institute of Clinical Excellence coming to actually have a question time session followed by their annual general meeting. This is a huge privilege to actually be asked to host this event, and we're looking forward to as many as possible of our staff and our stakeholders and colleagues to get involved. And finally, I just wanted to give a huge congratulations to those people who have been able to celebrate the success of not only being nominated for one of the Gala event awards, but actually winning that. The full details of who has won will be on our website, and I ask you to look to that and then congratulate those people personally for their fantastic achievement. Thank you.